it's an appointed day order effectively to bring in Part 3 of the Medicines Act 2003. What does that cover?
Part 3 is in relation to false advertising of medicinal products. So to put it in layman's terms, what it does is it prevents someone being able to go out and advertise a product saying that this medicine will do X, Y and Z when it doesn't. So it's ensuring that what you see on the tin is what you get.
Because this covers items sold at retail outlets, but it's also in pharmacies and prescription medication. So is this aimed at adverts towards the general public, or is it more about health professionals being given false information?
It covers both, actually. It covers both the advertising out to the general public, so the wonderful posters or adverts you might see saying buy this because it will cure this and do X, Y and Z, and then you find out it doesn't. It also prevents companies going out with misleading statements or misleading adverts to the professionals as well, effectively trying to lobby the pharmaceutical industry, trying to lobby and advertise with false or misleading statements to the professionals such as GPs or pharmacists.
Now, these regulations, they're coming in now. I mean, it's the Medicines Act 2003. Why hasn't this been brought in before now? I mean, that's what, 15 years?
Well, to be perfectly honest, we've not had a huge problem with it. And certainly I don't think we've got a huge problem. What the department's been doing is we've been looking at all the legislation that we have in place across the whole piece of the book of, the statute book at the moment. And what we're trying to do is saying where we've got something that hasn't necessarily been brought into force yet, because there's been no great clamour for it to be brought into force, is it sensible that maybe we should have it in place in case we do have an issue further down the line? And certainly in relation to the Medicines Act of 2003, I firmly believe that Part 3 should be there. Like I say, it's not a massive issue at the moment, but if something happened, it's good to have it in place and in force.
Now, will this bring the Isle of Man into line with the UK, or will it take it further than the UK is? Because if you look at it on the face of it, a lot of the advertising and a lot of the lobbying that goes on won't necessarily be directly within the Isle of Man. It's all external, or the majority of it would be external, and therefore out with the control of the government here.
And the thing I should mention is one of the things that Part 3 doesn't do is it doesn't prevent lobbying. You can lobby as long as you are making true statements. It is to stop false and misleading statements. So in terms of that, we are coming into line with the UK, where they do already have legislation in place there to prevent medicines being falsely advertised, particularly when you're talking about medicines. And obviously it's a very emotive subject because you're talking about people's health. I think it is important that when people are being pushed down a certain route for a medicine, be that the user or the professional who will actually be administering it, that it is important that there is honesty in that process.
Now, when it comes to things like prescription medications, surely the system of licensing and registration of medications when they enter the marketplace should be robust enough to stop any false claims being made. I mean, is there a loophole there somewhere that we need this additional legislation to stop people, once they're available, effectively not telling lies about them, but being misleading about them?
No, the regulation should be strong enough to prevent that, as you rightly say, with prescription medications. But I'm sure, as with anything, we can always quote one or two examples where the system hasn't worked. And I think when it comes to medicines, it's important we have that backup, that if something does fall through the net, there are powers there to stop the misleading statements being made.
And you say this is a broader review of the legislation. What else have you been looking at?
Well, I think it's important that as a department we look at all the legislation in place. As you know, there's the general scheme, which will be coming back to Tynwald. There were certain legislative issues with that, but that will at a future date be coming back. So we are, as a department, constantly looking at all the powers we hold. And the health moves on so quickly these days, and there's so many advances. It is important that we keep reviewing the legislation and making sure that we don't fall behind. And that's a continuous ongoing process.